According to the April 11th, 2019 issue of the Journal of the American Medical Association Oncology, 1/3 of cancer patients take supplements. Now, this is a very conservative estimate. Several other studies have published numbers in the 80 to 90 percentiles. However, there are estimates that 29 to over 50% of patients never disclose supplement use to their oncologist. So why is that important? Well, many supplements have the potential to increase toxicity of cancer treatment. And if the toxicity becomes too great, an oncologist may pause a patient's cancer treatment, causing treatment delays. I'm going to tell you the story of a 38-year-old woman named Jessica. Jessica is the mother of 2 children, and at age 33, she felt a lump and found out that she had breast cancer. She had hardly ever used drugs in her life and had often used natural medicine at home, so the thought of having to do chemotherapy was terrifying to her. When she was a child, her friend's mom had died of breast cancer, and she had promised herself at that time that she would never use chemotherapy if she ever had breast cancer. However, here she was with 2 children, and she was rethinking that decision, thinking that maybe she should do chemotherapy, but she still wanted to use natural medicine alongside that. She had advice coming from everywhere, people giving recommendations and suggesting what she should do. And she finally sat down to meet with her first oncologist. The first oncologist told Jessica when she asked that natural medicine was dangerous and she wouldn't allow her to use that. That just didn't feel right to Jessica, though, and wasn't going to fit for her. So she sought out a different opinion. And when she sat down with her new oncologist and asked about natural treatments again, her new oncologist referred her to me, and she started chemotherapy, feeling more comfortable and secure. I'll come back and we're going to revisit Jessica's story later.
For those of you who may not know me, my name is Dr. Katrina Bogdan, and I'm a naturopathic doctor. I am committed to providing safe, compassionate, kind, and knowledgeable integrative health care. And what this means is that I really get to take time to put together the individual pieces of a person's health puzzle together. In my last 14 plus years of practice, I have worked with thousands of people who have been diagnosed with cancer. And what those people appreciate most in working with me is the knowledge that I share, which opens many more options to them. Additionally, it has helped me to realize just how important it is to provide safe support as people are going through conventional cancer treatment. In the next 15 minutes, I'm going to discuss how a naturopathic approach can be safely and knowledgeably integrated with your conventional cancer treatment.
While my clients have many times received excellent care from their oncologists, they have come to me because they feel something is still missing in their care. They want to integrate healthy lifestyle and a natural approach with someone who is knowledgeable and safe. Our Healing Roots is here to be that missing piece for people diagnosed with breast cancer who want something more during their conventional treatment. Now, let's look at some common myths and misconceptions about cancer treatment and natural approaches. Do you believe or have you been told by a doctor that a multivitamin is harmless to take? In the cancer setting, sometimes a multivitamin can be harmful. Natural medicine, including even multivitamins in some cases, can interact, either decreasing efficacy or increasing toxicity, which can lead to treatment delays. Many doctors have told their patients that they can't take any antioxidants while getting cancer treatment because it will make their treatment ineffective. Now, this is based on a theory that radiation and some chemotherapies work by having a pro-oxidative effect. So taking an antioxidant would make them ineffective. However, when tested in actual human clinical trials, this is not true for every antioxidant. It is certainly true for some, but it's also not true for every single one. So it's important to consider each antioxidant on a case-by-case basis. It's a nuanced situation. Like Jessica, have you ever heard from a doctor that natural supplements should not be used during cancer treatment at all? Actually, when used appropriately, natural medicines have the potential to act as a natural, less invasive, and sometimes more affordable option for preventing side effects without reducing the effectiveness of treatment, and potentially could help prevent treatment delays. I'm going to share a few stories of my clients, but of course the names will be changed to protect their identity. I want to tell you the story of Sarah, who's a 48-year-old female when I met her with breast cancer. And when she was diagnosed with cancer, her doctor assured her that it didn't matter if she took a supplement because, quote unquote, they didn't work anyways. But she thought she should at least take a multivitamin. Her doctor started her on an oral chemotherapy called Xeloda. Now, one of the side effects of Xeloda is that it can cause something that's called hand-foot syndrome. And that's where the palms and the feet can become very red, very painful, and the skin can start peeling off. And one of the things that we know about this is that a vitamin called folic acid can increase the risk of developing this hand-foot syndrome. Now, Sarah had forgot to mention to her oncologist that she was on a multivitamin because, again, she thought it was completely harmless. When she came to me, she had really bad hand-foot syndrome, and her oncologist was having to reduce the dose of Xeloda because it had gotten so bad. When I talked to her, I discovered that she was taking a multivitamin with folic acid and that she also was eating a lot of foods that were being fortified with folic acid. So we switched her multivitamin to one that was very low in folic acid and decreased her fortified food intake, and her hand-foot syndrome got a lot better. So she was able to go ahead and continue her treatment without treatment delays. This is a case where something as simple as a multivitamin increased the toxicity of a chemotherapy medication. Now I want to share two other examples. Many new clients come to me taking probiotics already for their gut health. Probiotics are thought to be beneficial bacteria for digestive health. Neutrophils are a type of white blood cell that fights bacterial infections. If a person has a low neutrophil count because of chemotherapy, there is a potential risk that even beneficial bacteria, such as probiotics, can cause infection. I commonly recommend that people avoid probiotics in probiotic-rich foods like yogurt if they have a low neutrophil count, otherwise known as neutropenia. Ground flaxseed has gained a lot of interest recently for its ability to help decrease mortality for people diagnosed with breast cancer. However, ground flaxseed is also high in fiber. High fiber foods and supplements can inhibit the absorption of oral medication, so it's important to space the timing of fiber and oral medications away from each other by at least a couple of hours. Rebecca is a 34-year-old female diagnosed with estrogen receptor positive breast cancer. When I first saw her, I recommended 20 milligrams of melatonin at her initial consult. Remember how I told you earlier that sometimes antioxidants are actually very helpful during chemotherapy and radiation? Well, melatonin is an antioxidant and it can be helpful. And a meta-analysis of 8 randomized control trials for solid tumor types like breast cancer, remission rates and 1-year survival rates nearly doubled when 20 milligrams of melatonin was combined with chemotherapy and/or radiation. Now, it's important to emphasize that this is not the case for every type of tumor, but it was appropriate for Rebecca. Now, I do ask my patients to hold certain antioxidants like glutathione, NAC, and alpha-lipoic acid. The bottom line, though, is that not all antioxidants make treatment ineffective, and in some cases, they might even make it more effective. Working with a professional can help keep you safe in this decision-making process. I want to tell you the story of someone that I'll call Tanya. Tanya was self-employed and she didn't have great health insurance. Unfortunately, she was diagnosed with breast cancer. However, she chose to get treatment locally with an out-of-network provider so that she could continue to work at her business and make her health insurance payments. When she started chemotherapy with adriamycin and Cytoxan, she was advised that she would likely need to use a drug called Neulasta after each of the chemotherapy treatments. Now, Neulasta is a drug that's commonly used to help increase neutrophil count, which are the white blood cells that help fight infection. And because many chemos can go ahead and cause neutrophils to fall, and so it's a rescue drug. Now, according to GoodRx in August of 2019, a typical copay range for this medicine was about $1,463 to $7,166. For Tanya, her insurance copay was going to be around $3,000 for each injection. And mind you, she needed to get an injection after each cycle. So Tanya wanted to do everything in her power to keep her healthy blood counts. She chose to use a therapy called mistletoe, and she used this therapy 3 times a week during treatment. The cost was about $14 a dose. Her counts remained remarkably good throughout the treatment, and she didn't end up needing Neulasta until the very last chemotherapy treatment. As an additional bonus, mistletoe also helped to improve her quality of life during treatment. Tanya had very few side effects throughout the treatment and felt well most of the time. Importantly, she was able to keep working and keep her health insurance. Like melatonin, mistletoe is a therapy that's used only with certain tumor types. So it is on a case-by-case basis that this can be an option. So here are 3 important things that I want you to be able to take away from this talk. 1, do you now agree that supplements need to be carefully used in the cancer setting? This is an important time to seek professional help to carefully select your supplements and let your oncologist know what you are using. 2, even though you might be told that antioxidants can't be used during treatment, this needs to be considered on a case-by-case basis because in some instances, an antioxidant can be of great benefit. And 3, know that in many instances, there are natural, less invasive, and more affordable options to help reduce side effects. Now, you might be thinking to yourself, but my doctor says that using natural supplements is dangerous. Well, it can be when you use them inappropriately, but it can also be safe when you're working with someone who is appropriately trained. Now, you may have also heard a physician say that there is no evidence to show that natural supplements work. Actually, there is a huge online database called pubmed.gov. It's free, and there you can look at any number of peer-reviewed published trials and search for the supplement that you're interested in and the medical condition. And of course, there's not going to be evidence for everything. Not everything's been studied, but there are many examples here of supplements being studied with medical conditions, and you can search for it here for free. Now, you might be thinking to yourself, well, can I just look all this information up on the internet? You need to be very careful because not all cancer is the same disease, and it's highly dependent on your unique situation and your treatment plan. However, there is an excellent site that is evidence-based, and I often refer my clients to use it alongside my care, and it's called Beyond Conventional Cancer Therapies, or bcct.ngo. Now I want to go back and finish the story about Jessica. Her doctor referred her to me during her treatment. While Jessica didn't like the idea of doing chemotherapy, she was comforted that she could still follow her values and use a natural approach during conventional treatment, and thereby get the best of both worlds. When I first met Jessica, she signed a release form so her doctor and I could share our notes together. She safely used natural approaches and chemotherapy at the same time. During treatment, she had very few side effects and maintained a good quality of life. And today, her cancer is currently in remission. The big epiphany for Jessica is that she could safely use natural approaches and conventional cancer treatment together with her healthcare practitioners working to get her the best outcomes. Because ultimately, it was about her. She discovered that there was a middle way to safely use both conventional and natural approaches when used with expert guidance and practitioners who were willing to work together.
If you or your loved one is facing breast cancer, I offer a complimentary 20-minute discovery call where we can look at your individual situation and discuss how the goals of a naturopathic approach can help support your conventional care.
To take advantage of this offer, please go to ourhealingroots.net/missingpiece and click the Book Now button. Fill out the intake and consent form, then book your 20-minute discovery call.